Good afternoon, good morning, good night. No, not good night, good evening. We are ready to go for our next session. This is our 5th session in the Practitioner Education Series 2022 through the Safflower Academy. And this is the place where colleagues and Chinese medicine friends share their useful, practical expertise, and hopefully to help you to have a better practice, a better clinical practice, little tips and hints that might help you to do things a better way, an optimized way. It's from practitioners who may have developed their own style of practice, and they are generously sharing that knowledge with us today as well. So welcome. Each session is recorded, so you may just watch it whenever you're ready. You can break it down into 15-20 minutes fragments if that works better for you. There is also 3 to 5 quiz questions, which will then allow you at the end of our series to receive the certificate of attendance, which will give you 12 hours of continuous professional development points, which should be really good. It's about half the points that we should have every year. If you are here today, please raise your hand if you do have a very urgent question during the presentation. Otherwise, I'd be quite happy to add 10 to 15 minutes after the formal presentation to let you ask your questions. But if the question is burning, please by all means raise your hands, and so we know that you do need to ask a question. Today we will be talking about how best to prescribe the Safflower Herbal cream range. There's quite a few creams there, so I hope this will really give you confidence in using the cream range more extensively. I feel we still could do better with our creams. That's also with my own patients. So they are, here we go. But firstly, as always, I would like to acknowledge my past teachers and mentors who have very generously invited me to their space and shared their thinking with me and everything that they knew. I can honestly say that without them, I wouldn't be where I am today. So this is like 20 years since my graduation in Melbourne, and particular teachers that helped me in particular areas. For this area also, I would like to acknowledge Mazin Al-Kafachi. He is in the UK. He runs a business called Avicenna, and he would probably be the most experienced and charismatic expert in Chinese medicine dermatology on this planet. So truly standing on the shoulders of giants. Myself, I think you've seen that before. I graduated in Melbourne 20 years ago, 21 years ago now. I've been running Safflower since 2008. I did run the Safflower Clinic as well until recently, where I decided to take up a Masters of Research at NICM, Western Sydney University. And I'm now seeing a few patients a week from my home clinic, which allows me to keep the finger on the pulse of my patients. Maybe one thing that you might not know about me, which I just share, is that I like boxing. I really love boxing training, and I love watching boxing matches. But I also like yoga. So there you go. So we are looking at dermatological conditions, and there is many out there, and they do cause great havoc with our patients' health. However, this 60-minute or close to 60-minute presentation will just give you some basis on maybe making some optimized choices to using the topical creams that we compound for you. And even though we have been using those creams for 14 years, I do still not specialize in dermatology. There is colleagues out there that are much better equipped to look after specialized dermatology patients. So just bear that in mind. However, I think we can leave you with a much clearer and maybe more targeted message, which is what the aim was of these short presentations in relation to prescribing the herbal creams. So hopefully you will be able to make good choices for your patients. So we see patients from acne to skin cancers, most likely. Just a note of caution, if you do treat patients with cancer, then it might be good to become friends with the oncologist, treating oncologist, as you know, and might have experienced as well in practice. And this also includes skin cancer. Oncologists don't like to have other modalities interfering with what they're doing with their patients. But sometimes also it's very difficult to label a condition in dermatology, and you know, even is it contact dermatitis or is it eczema or is it both? And it's sometimes difficult to ascertain what part of psoriasis your patient is currently experiencing. Is it the acute flare, or is it just a stagnant, latent phase of psoriasis? Also, it's not always easy to make those choices, and not even dermatologists can make those, or, you know, can often identify the exact dermatological condition that they're treating. So also what I wanted to mention to you in terms of skin cancers, that the Australian Institute of Health and Wellbeing, I couldn't get any numbers on dermatological or top dermatological conditions in Australia, but the latest ABS data shows that there is about 30.8% of Australians who live with cancer who suffer from the most common type of skin cancers. And I also noticed, maybe at this point that would be a good time to mention that, the higher prevalence of young children who present with eczema, often in combination with asthma. But we'll talk about that very shortly. So yeah, all different skin expressions, different severities of dermatological conditions, and different manifestations of dermatological conditions. So we're going to go through some of them, but as I said, more in relation to the creams or applications of the creams, because this is not a dermatology class. This is a 1-hour session on how to help you make better choices for the creams. Yes, so if you do need more dermatological expertise, there's a few people in Melbourne who are very good at dermatology that I know personally, and Mazin Al-Kafashi came out, I think it's about 5 or 6 years now, and hopefully he will return to Melbourne at some stage, or to Australia in general. And so what he has to share about dermatology is just that next level. So yeah, go and see him if he does come back, hopefully. All right, so let's talk a little bit about the skin, and maybe some reminders that the skin is the largest organ of the body. It's considered an organ, so it's in between the exterior and the interior. So as you can imagine, the best skin is intact skin, or skin that has full integrity. So we should avoid, obviously, contact with skin irritants, or also ongoing pressure that's not released that will damage the skin. And very, very clearly, we have to encourage, which is what we do every day in clinic, to have a good diet, including, this is suggested by the Royal College of GPs, including a good diet, including zinc, vitamin C and D. I am not great in supplements. I'm a classical herbalist, but that's been recommended through the College of GPs. Some humans need more help with maintaining maintaining skin moisturization, so they might need to moisturize more, and there's different products out there to do that. Myself, I've been very lucky that I don't need to do that, and I've always stopped myself from doing it, because I think if we make it a habit, sometimes the skin becomes a little bit lazy and stops doing the moisturization itself. But again, this is suggested by the Royal College of GPs to maintain skin moisturization with emollients, which means soother and softeners. As we know, systemic disease can manifest firstly through the skin or through skin signs, and obviously the Australian sun plays big havoc on skins that is not protected. Skin obviously does guard our vital organs from external influence. And like other organs, as we just said, it does thrive on a healthy, balanced diet and suffers under the opposite of that, an unhealthy diet. Right, I think I've covered everything I wanted to say at this point. So it is considered an organ, and hence we have to treat it as an organ. And in Chinese medicine, it connects with other organ systems, as we know well from our theoretical framework that is plays an important part in traditional East Asian medicine. TEAM, actually it's the newest shortening, is no longer TCM, it's called TEAM, Traditional East Asian Medicine. So I'm going to use TEAM from now on. As we know, according to the actions of Chinese medicine, yin organs, the lung connects with the tissue of the skin. It manifests in the body hair. Its entrance is the nose. It's associated with sadness, and its climatic condition is dryness. So you do remember that from school, and it's sometimes just good to remember those details. In more detail or more deeper, the lung does warm the skin and secretes the sweat, or is in charge of the pores opening and closing, and obviously letting sweat out and stopping cold or external influences from coming into the body. So the lung does control the skin and the hair, the body hair. The connections to the skin, as you can see here on this slide on the right, is that it can cause dry, rough patches on the skin if there is external influence or internal imbalance. It can also show withered hair and excessive sweating or edema. So we can treat all these manifestations through the lung. Moving on. So now this is not a rhetorical question. What are the most important aspects of factors when treating skin conditions? And I just wanted you to have a think about and have a guess, because I'll tell you in a minute why. But what do you think are the most important aspects and factors when treating skin conditions? Have a bit of a guess. I give you two options. Is it more knowing the name of the skin condition, like is it eczema, dermatitis, psoriasis, or tinea or many more? Or is it more important to know the pattern differentiation? So is it hot, cold, yin, yang, excess, deficiency? Is it internal or exterior, or both? To be very honest with you, it should be a little bit of both. But if you don't have the label of the condition, what your patient is suffering from, then obviously it's better to know how to do a pattern differentiation. So, because if you know both, you might have just a little bit more of a refined knowledge and help you make more assumptions or anticipate a progression of a skin condition, because sometimes things get worse before they get better. And I can just tell you as well in this context that knowing the skin condition, I would always take that with a grain of salt. And even if it comes from a dermatologist, it just doesn't mean that that's what it is. I found a study where they measured in outpatients, or in an outpatient setting, they had a look at what non-dermatological experts were saying about skin conditions. And out of 20 top conditions or diseases, skin diseases, only 6 to 10 overlapped with those 20, so that's less than 50%. Like 20 were reported by dermatologists, and non-dermatological specialists, they didn't even get half of it right. So this study was a retrospective review of a large database, and only included skin conditions that were diagnosed in an outpatient setting, as I just said, and was done in 2014. So even if your patient does come in with a label, said, I've been diagnosed with this or that, you still have to take it with a grain of salt and do your Chinese medicine job, which is you have to do a pattern differentiation. So questions in relation to the skin that, and I do that each time as well, is the skin hot? Is it red? Is it more on the pale side of red, or is it really bright red? Is it dark red? Is there blood stasis? So does it show purple? Is there a lot of pain associated with the area? Is there itching or swelling of the area? Is it cyclical? Does it only come up once a month, like during menstruation, or does it come up during ovulation? Or, you know, is there any others? Are there any other cycles connected to that? Does it bleed? Does it bleed easily? What are the areas involved? Is it just the abdomen, or is it the limbs? What part of the limbs? Is it the inside of the limbs, the outside of the limbs? Is it called by an internal situation already? You know, is it called by digestive issues, caused by digestive issues? Or is it affected purely by the environment when they touch something on there, or they're in an environment with cats or dogs or other things that they might feel or might get or might have developed allergies to? So just as a head up, every time I see a patient and they might come in for something different, and they might say, well, I've also got this eczema type of condition, I would go through these questions and really take good note of what I'm seeing and what they're feeling. So the name of the label, the label or the name of the condition might give you a little bit of guidance, but then you still have to confirm what that means in Chinese medicine terms. And that's really the secret. Like, you know, I could stop my presentation here. This is really the secret. You just have to do a pattern differentiation analysis like you do with everything else. The same with the skin. And even later we have a look at the skin, the key indication and the labels and which formulas, you can take that as a start and then just see at the look at the herbs and say, well, this is what I'm thinking I'm looking at. So there is more heat, there is more dampness, there is more stasis. Then obviously you change the formula according to that. And we'll talk about that shortly. So that means you've identified there's redness, there's blisters, there's flaking, there is a lot of itchy, there's more itchy than swelling, there's more itchy than, you know, pain, things like that. You have to make a clear pattern diagnosis. And so the diagnosis should be easy now because you've had a look at it. You've taken all those notes, you know, when it flares, you know, when it settles, what helps it settle, what makes it flare. And then you just do your usual things. You do your pulse or tongue diagnosis, and you just use your eyes to look at the condition and say, well, this is what I think is going on. And then you combine that with the internal signs and symptoms. And obviously, is there an aspect of stress involved? And you would have to assess that as well, because according to the classics, and I don't remember if it's Shanghan or Qinggue, it says itching comes from the heart. So always bear that in mind as well. So there is a connection, even though I'm the first one to say sometimes you warm internally and you have to cool externally, or vice versa. But it still, there is a connection. And what we're aiming to do as Chinese medicine practitioners is just find that common factor that causes symptoms and signs. Like, you know, that's what I'm trying to do each time I'm seeing a patient. So it should be easy now. So you've got all your good skills in diagnosing, and you can do the same with the skin. That's really the point to this slide. And be moving on to the indication key, which just helps you a little bit to pinpoint what formulas might be suitable if you do have a name for the disease, and you can confirm that with your signs and symptoms and what you think is going on with that patient. And then you can go into the individual formulas and find out if they're suitable by looking at the herbs. That's how I do it. So this is the key indication table that we have on our website as well. If you can't find it, we're quite happy to send it to you. It comes with the cream documentation anyway. All right, now let's dive a little bit into the cream formulas, because this is what this is all about. Going okay with time, just checking. So I'm just going for the most common one. We do have some cream formulas that are very specific, and I can mention them to you in the end, but I really wanted to cover the most common ones. So eczema for the topical cream, obviously. I just wanted to make sure that we're all on the same page. So there's 3 formulas I'd probably choose from to start with. That's the Sanhuang Qi Shi, the Qingdai San, or the Wanglian Sugao. Now, Wanglian Sugao, I can tell straight away, is a very cooling cream. So it's only got 75% of cream base in it and 25% of Wanglian, which is one of the coldest herbs in the Materia Medica. So this is really where there's a lot of heat. A lot of swelling, maybe not so much itchy, not so much pain. So I don't use that cream very often. I must admit that to you. I tend to use more the Sanhuang or the Qingdai. So I'd use the Qingdai for a mild form of eczema. Qingdai San, which clears heat and dampness, stops itching, resolves toxicity. It only has Huangbai, sugar, Qingdai, washer, and cream base in it. I would also use that as a starting point in a young child, maybe at 6 months. I don't treat children below 6 months. I try not to, because it's a mild eczema cream, and it treats, you know, just a generalized version of eczema, nothing complicated. If there is eczema that needs a little bit more heat clearing, stopping itching, then I'd go for the San Huang. So maybe the eczema is in a more calm phase, then the Qingdai San would work really well, most likely. But if the eczema is quite active and it has a lot of heat and it causes a lot of itching, then the San Huang Qixi is your cream, your starting cream. Now, what we're also going to talk about later is how to modify your cream. You can modify each cream formula as long as you know what to put in and at what dose. Very easy to do. So just use this as a base. Take herbs out, put herbs in, combine herbs, and it's easily done because we make every cream from scratch. So we don't have any creams on the shelves. Ready-made. All right, next one, acne. As you can see, slightly different choices there. San Huang is there still if there's a lot of itchy, or, you know, it might be past that pustular phase of acne. San Huang Qixi works really well. If you do need something to address the heat and dampness and the pus, then I'd probably go more for the Qing Huang San, which has Da Huang, Huang Bai, Qiang Huang, Bai Chu, Zhang Zhu, Ganzao Pu Huang. So a little bit of blood moving, but also pus clearing herbs and heat clearing herbs. The Diandao San again sits in the middle a bit. Again, it's a more lighter formula for acne. It clears heat, purges toxins, stops itching, and kills parasites. Only has Da Huang and Liu Huang in it, with the cream base, obviously. Now, just a caution, Liu Huang is sulfur powder, and some people do have allergies. They usually know to sulfur powder. So San Huang Qixi for a very, maybe past that main point where it's very pustular and lots of yellow heads, I probably would more use the Qin Huang San. And then after that's passed and they become a bit less aggressive, the acne dots, I mean, not the people, then San Huang Qixi would probably be a better choice. For a light acne, Diandao San works quite well. Dermatitis can be quite intense. So Se Huang Gao, Se Huang is the 4 yellow cream. As you can see, it's got Da Huang, Huang Bai, Huang Qin, and Huang Lian, the 4 yellows in it. Hence, it does clear heat and toxins. So if it's quite red and hot and active, it also stops pain and disperses some of the swelling that might occur with that. Diandao San again sits in the middle, maybe a bit of a lighter version. And then the Huang Lian Su Gao, which only has Huang Lian in it. I probably would more go for the Se Huang Gao because it covers a broader action, because it does clear heat and toxins and it stops pain and disperses swelling as well. So my choice would be Se Huang Gao for a very acute dermatitis, and then for the lighter version of dermatitis, I'd go for the Diandao San again. with sulfur powder. So just a caution to your patients, or ask them if they have an allergy to sulfur. Psoriasis, so topical treatment. There's many different expressions and phases of psoriasis. It's a very insidious condition, hard to treat as well. And so we've got 2 creams there, and I'd say Yin Xie Bing Yu Qi Gao, the first one on the left, would be a more active phase of the psoriasis, and then for the scaly, more calmer, I'm going to call it calmer phase of psoriasis, you could use the Runjigao. Now, Runjigao is a very nourishing cream. As you can see, it's got sesame oil, beeswax in it, so it would put almost a little layer of protection on top of the psoriasis. Now, if you do have a lot of heat in your psoriasis, is not what you want, because you'll be trapping that heat and things will get worse. So Runjigao, I would really only use in that scaly, when the skin becomes scaly and those yes, a silvery scale looking sheddings occur, then the Runjigao is great, but not for the initial phase when it just becomes active and starts spreading and so forth. Then the Yin Xie Bing is a much better choice there, because it does it says it stops, kills parasites, but it's very heat and damp clearing. So that would be a better option at the beginning. Then we've got conditions such as tinea, scabies, lichen planus, topical, obviously, just making sure we're all on the same page still. So Kushentango is quite a good cream. I've just recently used it for someone who had most likely scabies on the upper arm. Scabies are a little animal that burrow into your skin, and it just itches tremendously, and it just drives everyone insane. So especially the person having scabies plus their partners and family members as well, because they'd be just not being able to stop scratching. It's terrible. So Kushentang also works really well for tinea, doesn't matter where it is, and it has mainly dispelling heat, eliminating dampness herbs in it. It kills parasites and stops itching. So Kushentang is an excellent cream for at least those 3 conditions. And wherever there is parasites, a lot of wind, so it spreads, and it and a lot of dampness, which is more, the itching sensation comes from the damp, actually not from the heat. And that's a really good cream to use for those situations. If we have abscesses and carbuncles, which it doesn't really happen that much anymore, we probably wouldn't see that much anymore in our clinics. But Jin Huang San, which was one of the acne creams, is really a good cream for that, because it doesn't just clear heat and damp, so redness and dampness, the itchiness, also prevents blood stasis, may stop pain and disperses swelling. So it's got quite a few herbs in it as well, and it's a great cream for abscesses and carbuncles, such as they can happen with acne. Really, very effective. We've just recently brought a new cream to our assortment, which was the herpes on the upper lip. Herpes, we haven't tried it on genital herpes, so we might do that at some stage and see how that works. But it's definitely indicated for herpes on the upper lip. It's called Hu Chung Gao, and it clears damp heat on the upper lip. And it has 5 herbs in it that do that really quite effectively. But you know, you got to have it there quickly, don't you? So you can put it on straight away as soon as you start feeling the tingling. The same for shingles, which can be at like a different intensity. Shingles may be very, very painful and can be very, very red and very spready. So either the Hu Chungao or the Huangnian Sugao. Again, Huangnian Sugao only has one herb in it at a big dose. Huangnian, which clears damp and toxic heat, might be a good cream. It's slightly yellow in color, so you have to warn your patients about the potential discoloring of clothes. However, it does absorb quite well, so if they put it on and then wait for it to be absorbed for maybe 5 or 10 minutes, the risks of discoloration of their clothes might be a lot less. Then some miscellaneous creams, which are the Gansao Yo, which also only has one herbal ingredient, Gansao, in it. It really works well if there's just dryness, like could be in older age, or could be because of the exposure to wind or cold, where we have more dry skin than usual. Works really, really well for that. It doesn't need a particular pathology, but can be just skin deficiency. I tend to add dangwei to the Gansao, and as I said, I will talk very briefly about how you can modify your creams, just in case you wanted to combine a couple of formulas, or you wanted to take a herb out and add another herb to it. The Banhegao, our scar cream, I don't know what the market is out there with scar creams, but this cream is sensational. I just gave it to someone last week who had surgery, and she put it on. I usually tend the patients to put it on 2 to 3 times a day if they can, and it just within 2 days, it just softened the scar, flattened it, took all the discoloration out of it, because they were quite dark red when I saw them. And she said that that's improved, like it's improved terrifically. So our scar cream works really well, and I've seen it on many different patients. But as I said, I don't know what the market out there is for that type of cream. This one is definitely a hit. We've also recently brought on the trauma cream, which I tend to use post-surgery. Just had a couple of patients who had hip replacements done, and they're using this cream on the entire area of the hip, around above the scar, you know, around the scar, because they often have, especially when they're a little bit older, which we usually are when we do need a hip replacement. It just works beautifully, and just it activates the blood flow. It helps with the pain if they have that chronic achy pain around that area. And yeah, so it's got at least 1, 2, 3, 4, 5 blood moving herbs in it. Yan Hu Suo, Honghua, San Qi, Moya, Ruxiang, and it works really well, that one, and Dangwei. So trauma for warming, not cooling. So we tend to think, or I tend to think, that cooling should only happen immediately after an injury, on, you know, just falling over and spraining your ankle or something like that. I always say to use ice within the first 20 minutes of an injury happening, and then after that it's warming. So I don't cool after that. After the time of 20 minutes, I don't cool, I would warm. So hence this warming trauma cream. Then we've also just recently brought a hemorrhoids cream on, which is intending to use to reduce local swelling and itching and stops bleeding and pain. And you can see from the herbs, it transforms damp, heat, toxic heat, moves the blood and the qi, and sun qi also stops bleeding. That's how these actions are brought to this cream for hemorrhoids. Molluscum contagiosum, which is a very interesting condition. I only hear it, children have it, and it's highly contagious. I'd give a San Huang Qi Shi for that to start with, but also would refine my diagnosis by looking at it and seeing what is actually happening and where is it spreading and what does it cause. Does it cause more swelling? Does it cause more itching? And then either use this as it is. San Huang Qi Shi is is probably the top 2 cream after Qing Dai San, and if necessary, modify it. For rosacea, I tend to treat rosacea internally more. It's kind of that redness that appears on the side here of the nose. If it's really strong, if it's really red and quite angry, then Dian Dao San would be a good option. It's got Da Huang, cooling, and sulfur in it. Again, caution for sulfur allergies. There could be an option to use Qing Dai San as well, which might work quite well because it's got damp and heat clearing herbs in it too. So either maybe Dian Dao San and Qing Dai San. So that's what we saw on the first eczema slide, where we had Dian Dao San in the middle and Qing Dai San. A comparison. I was going to go through individual herbs, but it's kind of a little bit beyond the scope of this presentation. So what I did is I just went into all the cream formulas and listed the herbs, and I've kind of put them into 4 basic categories, which might help you if you do want to modify certain creams. And you can, there's quite a few herbs there that you can play with. I don't think you need a lot of other herbs, and also a lot of the classical externally used herbs are toxic, so we shouldn't, and we can't use them. But this should give you quite a few herbs to choose from if you do wanted to modify one of the herbal formulas. So for the clearing heat herbs, the strongest one are at the top: Huang Lian, Huang Bai, Huang Qin, Da Huang, the 4 yellows. Ganso is probably slightly cooling. Zheganso is more tonifying, so because it's honey fried licorice, so I probably wouldn't use them to clear heat. Wouldn't use it to clear heat. That's why it's used in the Ganzao Yo cream. That's good for dryness because it moistens, it tonifies. So there is some, as I said, herbs can be in one category, but they can also be in several categories. So I tried to list them in the main categories. So, but it's easy to see, like huaqiao is a warming herb, but it does clear dampness, but it also warms your tummy. So you can see they can be sometimes in opposite categories. So this should give you a basic indication to what you should use or could use if you wanted to modify. Clearing dampness, huaqiao, baiji, difuzi is a classical external herb. Zangju clears damp, Yiren, same. Kushin, same. Sheshangpo, same. Huashe, clears damp from the skin. Shechuangs are the same, and Baibu as well. In the breaking stasis ones, so when a skin condition is a little bit more on the purple side or causes a lot of pain, then you need to add some breaking stasis herbs. There's a list here. We've had a look at them, or some of them before. Yanhu Suo Honghua, Moya Ruxiang are often used together. Zanji also stops bleeding, Pu Huang, Chishe, and Huai Hua. So these could be breaking stasis herbs that can be added to formulas that need to maybe clear heat or stop damp and also break stasis. And then some more unusual herbs. So Wu Mei is astringent, so it brings things together. It astringes. Xiakusao, don't remember now. Vitamin E, we only have vitamin E in one of the creams, which is the scar cream. Dongwei, which nourishes, tonifies, and then the sesame oil, beeswax. They're in the Runjigao, the psoriasis late stage scaly phase of psoriasis, because it's very nourishing. And then sulfur powder, and then Weiling Xian and Qixi. I forgot to remove that from that column. Sorry about that, because it's in the breaking stasis category. Now, if you are an acupuncturist and don't know the herbs well, or individual herbs, this might be a good selection to get you started on some herbal knowledge. And I would suggest to invest in a good book, a herbal book such as the Materia Medica, Bensky, and etc., or the Chen and Chen is good as well. It just gives you so much information about one individual herb, and that might be a good motivation to get started on some herbal knowledge, because it's kind of contained to those herbs. So once again, if a cream indication, so do not be bothered if the cream indication is different to what choices you would make for your patient, then go with that, because you would have done a pattern differentiation and then choose a different formula with different individual herbs than the one that's on the cream indication key. So this is our cream base. We use a plant-derived cream base. It's hypoallergenic, so it works well with people with skin conditions, especially if they have allergies, and it's paraffin-free. However, to make the cream longer lasting, it has a preservative, which is called Nipastat, is at the bottom of the list in it, and it just prevents the growth of fungus and bacteria if, you know, we touch it with our hands, and then it may grow bacteria from that, just that because we haven't washed our hands, we touched our dog before, something along those lines. Anyway, it does have that in it, but a very, very small amount. And in those past, I don't know, we've used this cream base for 10 years or more, at least. We haven't really had, or we haven't been reported any allergic reaction to the cream or cream base. Sometimes it's the formula, obviously. But it's a very, very smooth cream base. It works really well, and it combines well with the herbs as well. Cream base details, and so here is now an example how you could compose your own formula. So I used a Jingdai-san from the drop-down list in the formulas, which, as you know, populates the individual ingredients. And in that instance, I wanted to add Kushen because there was more itching. So I added Kushen, and to recalculate, so I had to delete the cream base because to add a herb, you either have to change it in the drop-down list or you have to delete it, and then you can only add it at the bottom, which then happened. I deleted the herb and then added Kushen, and then the cream base was in the middle somewhere. So I just brought it back to the last ingredient of the list because that's how we dispense it. We put the herbal ingredients first, and then we add the cream base, and then we mix that. So it requires a little bit of recalculation, but it's a very easy equation. So you just have to add up the individual cream herbal ingredients. So you add up 4.5 plus 2.5 plus 9 plus 9 plus 4.5, which is 29.5. And then you multiply that by 3, 88.5. You add your cream base at 88.5, which you can see in the percentages, it will be 75%. And this is what we are aiming for. We need to have the cream base at 75%, and we need to have the herbal ingredients at 25%. And we've tested this before we made the decision that's what we're going to go for, because either the cream is too runny or it's too fluffy and there's not enough herbal ingredients there. So this is the best consistency for your cream, the easier, the most easiest to apply on your skin and the best absorption. So that's why we have this 75% distribution. Excellent. That's how to compose your own cream formula. You can compose your own cream formulas from scratch. It doesn't have to be a modification of our existing formulas. You can do whatever you like, but just be clear that you've gone through the process of a pattern differentiation. So you're either giving warming or cooling or dam clearing or blood stasis, removing herbs. So you've got to be clear on that. That's your job, and then we can help with the rest. So in essence, and maybe as a discussion, cream formulas require as much for pattern differentiation as any other formula. So I'm saying this so many times because we get practitioners ring us every day and say to us, oh, my patient has eczema, which cream do I have to give them? And then I go, well, tell me more. So that's why I keep repeating this, because it's one of the frequently asked questions. In my experience, the best approach is to treat dermatological conditions internally and topically. I understand that as an acupuncturist, you then have to use patents or use our service if you wanted a little bit of a stronger version of your internal herbs, like one of the classical formulas. Don't make it too complicated. You know, even a basic pattern diagnosis is going to be better than just choosing a cream next to the label of the disease or the condition. I would go, if you're in doubt, you can always ring us and we can maybe help you or guide you. I go more light and maybe use a smaller jar, and then choose a bigger size if you're happy with the results, or, you know, the patient reports good results the next time you see them. Feel free to tailor and customize the creams to as much as you like. as long as you treat what your patient is presenting with. And I think I'm pretty much very good with time management today. I still find it a little bit difficult to talk to a screen. I'd rather have an audience here to talk to. So sometimes I get, I just have blockages because I don't have faces and emotions coming my way. So I apologize for that. I hope you got the most out of it, being confident in prescribing creams. We'd love you to do that, because there's not enough creams going out the door, because they are very effective. And I'm guilty myself. I don't always prescribe them, or at least not at the start. So it should be a message to myself as well. I appreciate your time today. I hope you have an excellent day, evening, week, month, until we meet again. And be confident that you can prescribe the cream formulas using the steps that we just have discussed, and a little bit of diving into the world of creams and herbs. Many thanks for being here, and we'll see you again soon. Thank you very much.